In this video, I will cover our new and unique process to help fix chronic shoulder pain without the use of medications or injections. Expect to learn the following: what causes rotator cuff injuries and shoulder bursitis, what causes a frozen shoulder, what causes shoulder impingement and cartilage damage, and our new and unique treatment process that helps to fix chronic shoulder pain naturally. My name is Dr. Matt Maggio, and I am a soft tissue injury treatment expert, specifically for chronic headaches, neck, and shoulder pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain without the use of drugs, injections, or surgeries, which leads to a significant increase in overall functioning, flexibility, and long-lasting pain relief. I wanted to make this video to really help educate anyone that's thinking about coming into my clinic or getting treated by a provider trained by me, to help give a better idea of how we approach chronic pain. Specifically in this video, going to cover rotator cuff injuries, shoulder bursitis, frozen shoulder, and then shoulder impingement and cartilage damage. So let's start just with rotator cuff injuries and shoulder bursitis. So what causes those to happen in the first place? So over time, with, I'd say, poor posture, not being active enough, sitting too much, not moving around. Also, just from overuse too, maybe you're working out too much, it puts more wear and tear on the muscle. And the muscle doesn't get enough blood flow and oxygen. When this happens, it sends a signal to the brain. The brain goes, hey, what's going on here? And it starts to pump out this stuff called collagen. Helps build the muscle, but it doesn't have enough time to pump it out. It's not fully cooked. And then it gets inside the muscle, makes it less flexible and weaker, and really starts to kind of spread out. And over time, it then can't allow the muscle to generate the force that it needs to and provide stability to the shoulder. So it puts more wear and tear on all the structures around there. And specifically in a rotator cuff injury, it puts more pressure on the tendons. When it puts pressure on the tendons, then you start to see some of that damage. Sometimes it might actually show up with like partial tears in the rotator cuff on an MRI and can cause some issues. Then, as that starts to happen, the body wants to try to heal it. So it wants to create some inflammation. When it does that, it creates what's called bursitis. And bursitis is done for a reason, to go in there and try to like heal up the area and help. But the problem with the bursitis is it's a response to the shoulder getting overloaded. It's not the actual cause, but it's the effect of what's going on. And a lot of times people want to get rid of the bursitis, but it wasn't what caused it in the first place. So when this happens and there's bursitis in there, there's the tendons getting overworked, there's all that adhesion in the muscle, the shoulder just can't do what it's supposed to. It can't move how it's supposed to. It's not supported. And then it can cause some pain, decreased range of motion, just weakness and difficulty doing normal shoulder movements. And that by itself is bad enough. But then what else happens over time is there's a tiny nerve that starts at the base of the neck and makes its way through some of the muscles back behind the shoulder blade. That helps to control the muscles in the shoulder. And what happens over time is it actually gets stuck inside those muscles when that adhesion is building up, and can present with some numbness, aching, burning, and tension. When the nerve actually gets stuck in there, it causes a lot of problems because the body doesn't want the nervous system to be compromised. So it'll continue to put more wear and tear on other parts of the shoulder, more on the tendon, more on the joint, more on the cartilage and the ligaments in there. And then that problem continues to get worse and worse. The problem is when someone does find one of those entrapments going on into this nerve, they actually don't treat it correctly. They're actually too aggressive. Nerve entrapments want to be treated just right. I call them like Goldilocks of the injury presentation. They want just the right amount of depth, just the right amount of tension. And when most providers encounter them, they're just way too aggressive. They go way too deep. They're too aggressive on there. And temporarily it stimulates the nerve, but didn't actually fix anything. And then that problem continues to get worse and worse. So when rotator cuff injuries are there, especially when there wasn't like a true mechanism of injury or trauma, just kind of comes out of nowhere. It starts with the adhesion, then goes to the tendon, then the bursitis, then nerve entrapment. So what we do is we start by fixing the nerve entrapment first, then going in and cleaning up the muscle, taking the pressure off of the tendon. And this is how you can get issues fixed without aggressive things like surgeries, injections, or pain pills, to get a natural solution for that shoulder pain. So next up is frozen shoulder. So how does this happen in the first place? So as I explained earlier, the adhesion starts first in the muscles and the nerves, and then it puts more pressure on the tendon and it puts more force in the area. So it causes the shoulder to have to work different how it's supposed to. And then there's this, it's like a ball of ligaments. It's called your capsule, and it really helps provide stability and motion and keeping the shoulder moving how it wants in a nice supported position. But over time, that ligament has to work harder to make up for all the other muscles and the nerves getting stuck. And then it actually develops a lot of adhesion. And now the capsule can't stretch how it's supposed to. It's like a stretched out rubber band. And then when this does happen, it first starts with just some very limited range of motion. It might be painful to sleep on it, and then just some decrease in overall functioning in movement, but it really puts some pressure down on the capsule. Now, when the capsule gets treated, it's actually kind of difficult to get to because it's deep to some muscles. It's between the deltoids and the tricep. And a lot of times when providers are trying to address it or treat it, they're actually treating on the deltoid or they're treating on the tricep, and they're not actually treating the capsule effectively. Some people will go to some great lengths and get like these really nasty injections, or they'll even do something like called manipulation under anesthesia, where they knock you out and they move that shoulder through that whole motion. It's pretty barbaric. Basically, with the capsule, the key in what I do and what my providers do is we're able to isolate it and know exactly where it is. We really slow down with the palpation and know we're right on it. And this one actually needs more pressure, more depth, but really in a focus area. Like I said, a lot of providers are just off of it. And if you don't know where it is in the first place, you're not going to actually be able to fix it. So a lot of times people will try some really aggressive things with injections and that manipulation under anesthesia. And a lot of times this can actually be addressed very naturally, very effectively, with a little bit of pain when it gets treated, but nothing excruciating. Can really help restore some of that range of motion. As you get the proper depth and tension into that capsule, it allows it to free up, and then you get some blood flow and oxygen back to the area, and then the capsule starts to heal up and starts functioning a heck of a lot better without all the extra crazy stuff in there that can actually cause a lot more pain and discomfort. So the last one that I see a lot in the clinic is just shoulder impingement and cartilage damage. Basically, it just means that something's getting stuck in there as the shoulder is moving. It doesn't really give us a full idea of what's going on, but basically what happens, I see this a lot in people that have a high history of trauma in their shoulder, maybe from like playing sports or accidents. And what it does is it really just kind of changes how the shoulder moves and how it functions. And when there's a lot of adhesion buildup in this muscle in the front of the armpit called the subscapularis, it's the only muscle that supports the shoulder from the front. So now it doesn't have front support. So the shoulder starts to kind of duck forward. And when it ducks forward, it continues to put more wear and tear on the tendons, on the capsule, on the ligaments. But then it also can alter how everything's moving. It's kind of like running your car with a bad alignment and it blows out the tires. And that's where the labrum starts to have problems, or the cartilage in the shoulder. And a lot of people get what's called a slap tear, where it starts to fray and causes some damage in there as well. So the way I look at it is, yeah, you might have the slap tear, you might have all that stuff going on in the tendon, but what's around there is all of the adhesion in the subscapularis in the front there. It's kind of like your thumb stuck inside a car door. We can't give this a chance to heal up until we remove that. So a lot of people will jump into a surgery right away. They'll be like, oh, I saw an MRI. I got cartilage damage. I have a rotator cuff tear. I have frozen shoulder. They say I need surgery. But all of those things, as I talked earlier, are really the effects, but not the true cause. So a lot of people have surgery, but they didn't actually fix that problem. It's like they removed the door for a minute, but then they slammed it right back down. That's why a lot of people have repeated shoulder surgeries, because they're treating so much of the effect and not the direct cause. So that's what we really specialize in the clinic, is finding and fixing that underlying nerve entrapment in the muscles, in the ligaments across the board, and treating it naturally without pain pills, injections, or surgeries, which allows it to heal up and give it a chance without having to go under the knife right away and getting a surgery that has a lot of side effects and a lot of risks. So that's all I got for the video. If you've been dealing with a chronic shoulder pain for at least 6 months, you've seen way too many providers, and you're still having issues, then reach out directly to us and request a no charge injury consultation to get some real answers as to what is going on and get on the path to long lasting pain relief so you can stay away from medications and injections, which only make things worse. All the information to request a consultation is in our profile or wherever you're watching the video.